Episode 56 RW March 15, 2024. Steps to control COVID. Apply them to control PM2.5 from wood burning. In episode 56 RW, the common denominator is concern about human health. 1. Comparing steps to stop indoor residential wood burning with steps to control spread of COVID before vaccines were available. 2. MIMS for Lungs calls for ban on indoor residential wood burning in the United Kingdom. 3. United States, North Carolina. In vivo wood pellet plant files for bankruptcy. 4. United States. Green Building Council, USGBC, and PM2.5, 5. Alabama, Anniston. Intentional wood smoke pollution and a fire of unknown origin. 6. Minnesota, Kimball. Large fire in a woodpile. 7. New York, New York City. Rule requiring pizzerias to cut smoke. Letter to the editor saying wood oven smoke is bad for New Yorkers' health. 8. Texas, Panhandle wildfires highlight need to protect firefighters' health. 9. Canada, British Columbia, Courtney. Air quality monitors up and running. 10. United Kingdom, London. The unhealthy air quality of the London Underground tube and its effect on staff. 11. Europe. Air quality in last 2 decades. 12. Japan. PM2.5 and cancer. 13. PM2.5 and accidents. 14. PM2.5 and disparities. 1. Comparing steps to stop indoor residential wood burning with steps to control spread of COVID before vaccines were available. Look at some helpful, proactive steps used to control spread of COVID, then apply similar proactive steps to control emissions of PM2.5 from wood burning, because wood burning emissions have been scientifically shown to cause many types of cancer. Everyone is aware of the steps health authorities suggested to people to stop the spread of COVID before there were vaccines. Those proactive steps save lives. 2 helpful, life-saving steps taken to control COVID spread. Be aware that COVID is an airborne, contagious disease. Wear a mask. So, to keep it simple, be aware that indoor residential wood burning emits airborne particulates. Stop indoor residential wood burning without entering the homes of the wood burners. Detect the pollution from wood burning with purple air PM2.5 monitors hung from the eaves of the homes of near neighbors of indoor residential wood burners. Download the data from the purple air monitors every 3 days. Analyze the data to show levels of PM2.5 above Environmental Protection Agency National Ambient Air Quality Standards, EPA NOx. Show the analysis to health authorities, acting as a citizen scientist. Ask the health authorities to shut down indoor residential wood burners, one by one if necessary. A complaint-based system will not overburden health authorities, and the resulting improvement of public health will lessen the need for future interventions from public health authorities and save the near neighbors future high medical bills. Those particulates, emitted from smokestacks of indoor residential wood burners' homes, do not magically disappear when the smoke goes up the smokestack. PM2.5 and CO2 from indoor residential wood burning enters the yards of near neighbors and sickens them. PM2.5, particulate matter of 2.5 micrometer size, is the perfect size to infiltrate the human lung, setting off a cascade of human health problems and early deaths. Wood burning emits 2.8 times the PM2.5 and CO2 as the fossil fuel coal burning. Wood burning emits 450 times the PM2.5 as the fossil fuel natural gas burning. Don't burn wood to begin with. Use the clean alternatives of wind and solar power on an electric grid reaching all rural areas to power heat pumps that work down to 40 degrees below zero. The Fahrenheit and Celsius temperature scales converge briefly at 40 degrees below zero. Think of our lives together as if we were on a lifeboat. Should you start burning wood on a lifeboat? Should you use a solar panel to generate heat for cooking a fish? Okay, maybe this is too hypothetical. There was a scientist named Maria Telks, an immigrant from Hungary to the United States in 1934, who dedicated her life to finding practical applications of solar power. She created a solar home in the cold Northeast in the 1940s that worked for a few years, but was undone by glitches that we have solved today. She also created a solar-powered balloon for use on life rafts in World War II that converted salt water to drinkable water. Use of this salt water converter was stymied by a jealous colleague, so that the balloons could not actually be used during World War II. Today, we have low-cost, resident-owned purple air PM2.5 detectors, called monitors, with the data available for the general public to view, and data captured in real time and easily downloadable every 3 days. Widespread use of these detectors in the hyper-localized yards of near neighbors of indoor residential wood burners could pinpoint the source of PM2.5 pollution that causes disease and early death for these near neighbors. Health authorities could be notified and the source of the air pollution could be shut down. The neighborhood indoor residential wood burner could be shut down. This could save lives. That is a simple step to take to have a real positive impact on the lives of many people. 2. United Kingdom. Mums for Lungs wants to ban wood burning. View. The last paragraph of this article gets to the simple solution of the problem of indoor residential wood burning. Mums for Lungs wants wood burning stoves outlawed. Geographical home burning of solid fuel is one of the largest sources of primary particle pollution. A campaigning group of mothers is calling for a ban on wood burning stoves as evidence mounts on their threat to health, PM2.5, in the UK, greater than the particles from traffic. Excerpts edited by for brevity and clarity in relationship to Residents Against Wood Smoke Emission Particulates, a 501c3 nonprofit organization. A solid ban. Looking ahead, campaign groups such as Mums for Lungs are calling for government action. In the short term, they're asking for proper health warnings on stoves. You don't buy cigarettes without a warning these days. You shouldn't buy stoves without a warning, a Mums for Lungs founder said. Given the confusion and lack of enforcement of new rules, Mums for Lungs are calling on the government to simplify the situation by phasing out domestic wood burning where alternative heating exists, she adds. Indoor residential wood burning is called domestic burning in the United Kingdom. Mums for Lungs is calling for a halting of sales of new wood stoves by 2027 and a ban on the use of wood burners unless they're the only source of heat by 2032. Because pollution has a much bigger impact at much lower levels than we previously expected, wood burning has no place, she concludes. A scientist agrees. We need to move away from a message that solid fuel heating is a normal way to heat a home, he says, and instead leave it as a polluting relic from the last century. In episode 56 RW, the common denominator is concern about human health. 1. Comparing steps to stop indoor residential wood burning with steps to control spread of COVID before vaccines were available. 2. Mums for Lungs calls for ban on indoor residential wood burning in the United Kingdom. 3. United States, North Carolina. Enviva wood pellet plant files for bankruptcy. 4. United States. Green Building Council, USGBC, and PM2.5, 5, Alabama, Anniston. Intentional wood smoke pollution and a fire of unknown origin. 6. Minnesota, Kimball. Large fire in a woodpile. 7. New York, New York City. Rule requiring pizzerias to cut smoke. Letter to the editor saying wood oven smoke is bad for New Yorkers' health. 8. Texas, Panhandle wildfires highlight need to protect firefighters' health. 9. Canada, British Columbia, Courtney. Air quality monitors up and running. 10. United Kingdom, London. The unhealthy air quality of the London Underground tube and its effect on staff. 11. Europe. Air quality in last 2 decades. 12. Japan. PM2.5 and cancer. 13. PM2.5 and accidents. 14. PM2.5 and disparities. 3. United States, North Carolina. Enviva wood pellet plant files for bankruptcy. The world's largest global industrial supplier of wood pellets just filed for bankruptcy with Fortune Smith is among many environmental activists who have long contested Enviva's claims that its production process and burning wood for energy is. Wood pellet producer Enviva files for bankruptcy and plans to restructure the Seattle Times burning wood for energy is carbon neutral and helps revitalize rural areas. Opponents argue that the harvesting of forests and burning of wood pellet giant Enviva files for bankruptcy. Wilmington Star News burned them as a replacement for coal and other fossil fuels. The idea is that burning wood instead of coal or natural gas is better for the wood pellet maker. Enviva declares bankruptcy, hopes to emerge stronger. What went wrong? Yahoo News. Scientists and ecologists point out that burning wood pellets releases more carbon dioxide than burning coal and that it may take decades for 4. United States. Green Building Council, USGBC, and PM2.5, school research highlight. PM2.5 U.S. Green Building Council USGBC and the fine particulate matter, PM2.5, research highlight. You will find new research from the U.S. and around the world on the impacts of PM2.5, 5, Alabama, Anniston. Intentional wood smoke pollution and a fire of unknown origin. Outdoors wood smoke rises from intentional and unintentional blazes. The Anniston Star, a fire of unknown origin that began Tuesday on Coldwater Mountain, is under control, though still burning, Anniston Fire Chief Jeff Waldrep said. 6. Minnesota, Kimball. Large fire in a woodpile. Kimball, Minnesota. Homeowner reports large fire in woodpile. West Central Tribune South Haven Fire Department extinguished the fire in a woodpile located next to a wood-burning stove. 7. New York, New York City. Rule requiring pizzerias to cut smoke. Letter to the editor saying wood oven smoke is bad for New Yorkers' health. Cuomo's congestion price condemnation. Letters to the editor, March 14, 2024 New York Post. Wood oven smoke is bad for New Yorkers' health. I never realized that smoke from pizza ovens was having such a negative effect. I thought crime. New York City approves rule requiring pizzerias to cut smoke pollutants by 75%. MSN smoke pollutants. The new rule will take effect on April 27th and will affect about 130 businesses. It requires pizzerias and bakeries using wood. 8. Texas, Panhandle wildfires highlight need to protect firefighters' health. Panhandle wildfires highlight need to protect firefighters' health. Texas A&M Today. Texas A&M University Chong said wood smoke contains many of the same harmful substances found in cigarette smoke. 9. Canada, British Columbia, Courtney. Air quality monitors up and running. Air quality monitors up and running in Courtney City of Courtney. Fine particulate matter, also known as PM2.5, is the greatest threat to common sources of PM2.5 include smoke from residential wood burning. Common sources of PM2.5 include smoke from residential wood burning appliances, open burning, and wildfires. So far, the highest PM2.5 readings, 10, United Kingdom, London. The unhealthy air quality of the London Underground tube and its effect on staff. New research on health impacts of air quality on London Underground staff. Air quality news. PM2.5 exposure is directly contributing to sickness absence. Imperial PhD candidate and first author of the study Just IMAX said. 11. Europe. Air quality in last 2 decades. Air quality in Europe shows significant improvements over the last 2 decades. Study finds Eureka alert. Targeted efforts are needed to address PM2.5 and O3 levels and associated compound unclean days, especially in the context of rapidly increasing. Air quality in Europe shows significant improvement since 2003. But unhealthy pollution health policy watch. But PM2.5 concentrations also saw significant declines, with the number of clean air days rising and unclean air days declining to about 90 days a. 12. Japan. PM2.5 and cancer. Comparing the risks of environmental carcinogenic chemicals in Japan using the loss of ScienceDirect.com. Second. Using the survey data, LHPLE was calculated for fine particulate matter, aerodynamic diameter less than 2.5 micrometers, PM2.5, 13, PM2.5, and accidents. Air pollution. Do accidents matter? American Council on Science and Health PM2.5 and are unlikely to be controlled by the proposed regulatory action. Because of its myriad sources, ambient PM2.5 exposures cannot be reduced. 14. PM2.5 and disparities. Widening of disparities in pollution-attributed health burden observed. Health Day 2.5 micrometers, PM2.5, through a health impact assessment. The researchers found that the public health damages associated with NO2 and PM2.5 decreased.